My name is Laurence Cibrelus. I'm leading the Secretariat of the Global Strategy to Eliminate Yellow Fever Epidemics, the I strategy. This week is World Immunization Week and a great opportunity to remind how vaccines bring us closer to eliminating yellow fever epidemics. Today also marks the launch of the Immunization Agenda 2030, which is a strategy to ensure that more vaccines reach more people of all ages, providing health equity and security for as much people as possible. The past year has been challenging for everyone involved in the I strategy, but the I partnership and its associated mechanisms have been instrumental in overcoming some of the barriers caused by the pandemic. By having a well-established weekly technical forum, which brings together technical officers from high-risk regions and colleagues from the epidemic intelligence, surveillance, laboratory, immunization, and emergency groups, we were able to access information that we otherwise would not have had in a timely fashion, to provide support remotely, and to understand the challenges on the ground and suggest solutions. For example, the engagement of the I Secretariat and partnership was critical to secure essential infection prevention and control supplies and personal protective equipment for the continuation of large-scale preventive campaigns. 2.5 million masks were donated by the Operation Support and Logistics Group in WHO. The CDC Foundation supported the purchase of 5.6 million vaccination cards and hand sanitizers for the completion of a national yellow fever preventive campaign in Ghana. And several millions were made available to support safe yellow fever campaigns in the COVID context via an agreement between the US CDC and UNICEF. The engagement with other disease programs to seek efficiencies and integration was also instrumental and should continue as the way forward. For instance, there were dual yellow fever campaigns with meningitis A in Nigeria and with measles. In DRC, the current yellow fever campaigns will be an opportunity to protect the measles zero-dose children. And we're also striving to be systematically opportunistic in our vaccination approaches. For instance, in Sudan, a dual yellow fever and cholera activity to protect refugees from northern Ethiopia was also used to catch up children for yellow fever vaccination. Our priorities were to ensure continuation of essential immunization services to prevent and control yellow fever outbreaks, as well as to prepare for post-COVID times and long-term implementation of immunization activities, such as the introduction of the yellow fever vaccine into the routine immunization schedule in Uganda and Sudan. Despite the challenging context of the pandemic, in 2020, about 45 million people were protected against yellow fever for life by mass vaccination campaigns in Nigeria and Ghana, with an additional 2.4 million people protected by a outbreak response in Ethiopia, South Sudan, and Uganda. Overall, more than 140 million people have been protected from yellow fever for life since the inception of the I strategy in 2017. And although the 2020 vaccination results account for about 60% of the initial target, with the DRC campaigns postponed to 2021, almost twice as much people were protected by campaigns in 2020 as compared to 2019. The elimination of yellow fever epidemics remains a critical challenge to take on, even more so as the pandemic increased the risk of yellow fever on both the short and longer terms, with reduced ability to timely detect and control yellow fever outbreaks, and a growing accumulation of yellow fever immunonaive populations, as essential routine immunization services were negatively impacted by the pandemic. The I strategy is committed to the Immunization Agenda 2030, particularly continuing our work to integrate and coordinate primary healthcare services to deliver vaccines everywhere to everyone at every age. Vaccines do bring us closer to eliminating yellow fever epidemics.